As we age, many of us start to worry about our health more than ever before. Blood pressure, in particular, becomes a topic of concern for those over 65. But here's the question. What if the recent recommendations about blood pressure management are leading some people down a path that could do more harm than good? For many older adults, the latest guidelines are encouraging a push for lower blood pressure targets. But what if trying to bring those numbers down too far might not be the best choice? Could it be putting your health at greater risk rather than helping you live longer or feel better? In this video, we're going to dive into the most recent updates to blood pressure guidelines and explore how they directly affect older adults, like you or your loved ones. We will also discuss how you can balance managing your blood pressure with maintaining your overall well-being, something that is often overlooked in all the numbers and medical jargon. We'll take a look at real-world studies, like the Chrt and Chrt trials, that have provided key insights into how aggressive blood pressure treatment can have both benefits and risks. We're going to explain how these studies have shaped our understanding and offer you concrete tips for managing your blood pressure in a way that works for you, not for a generalized approach that may not be ideal. Stick around to discover why there's no such thing as a one-size-fits-all solution when it comes to blood pressure. We'll talk about how to avoid the potentially dangerous side effects of over-medicating and how personalized care strategies can help you maintain your health and vitality as you age. By the end of this video, you'll feel more confident in making informed decisions about your health, especially when it comes to managing your blood pressure, and will help ensure that you don't miss any critical signs or symptoms that could affect your quality of life. Let's get started and find out how you can take control of your heart health, live longer, and feel better every day. And before we jump in, if you haven't already, please hit that subscribe button and ring the notification bell so you don't miss any of our future videos. Your support means a lot to me, and if you find this video helpful, consider liking and sharing it with others who might benefit from the information. Lastly, if you're interested in the topic of this video, please leave a comment with a 1. If you're not sure or you'd like to see something different in future videos, feel free to comment 0, so I can continue improving and making content that's more valuable for you. Now, let's dive in. ACC/AHA 2017 Guidelines. In 2017, the American College of Cardiology, ACC, and the American Heart Association, AHA, released a set of new guidelines that shook up the way high blood pressure is diagnosed and treated. These updated recommendations represent a major revision of earlier standards, aiming to offer more accurate and effective ways to manage blood pressure, especially for older adults. One of the most important changes is the lowering of the threshold for what's considered high blood pressure. Previously, a blood pressure reading of 140/90 mmHg was the cutoff point for those under 65, and a reading of 150/80 mmHg was acceptable for those over 65. However, under the new guidelines, any blood pressure reading of 130/80 mmHg or higher is now classified as high blood pressure, regardless of age. But what does this mean for you as an older adult? Well, with the new standard, you may find that your blood pressure classification has changed. A systolic reading of 140, which was previously considered acceptable for individuals over the age of 65, is now categorized as either stage 1 or stage 2 hypertension. That's a significant shift in how doctors will assess your blood pressure and, consequently, how they might recommend you manage it moving forward. So, how do these changes affect you in practical terms? The new guidelines now define normal blood pressure as less than 120/80 mmHg. If your numbers fall between 120 to 129 millimeters of mercury systolic and less than 80 millimeters of mercury diastolic, you're in the high normal range. Stage 1 hypertension now begins at 130 to 139 millimeters of mercury systolic and 80 to 89 millimeters of mercury diastolic, and stage 2 hypertension is defined as a systolic pressure of 140 millimeters of mercury or higher, or a diastolic pressure of 90 millimeters of mercury or higher. For many older adults, this is a significant change, especially those who previously had blood pressure readings around 140. What was once considered acceptable may now require treatment, depending on your health history and overall risk factors. These new guidelines are designed to help identify and treat hypertension earlier, potentially reducing the risk of heart disease and stroke. But it's important to keep in mind that treatment should always be personalized. What's most important is how these changes impact you, and finding the balance between managing your blood pressure and maintaining your overall well-being as you age. Let's take a deeper dive into what these changes mean for your health, and how you can navigate this shift in a way that's right for you. High blood pressure in older adults. Natural changes. As we age, one common question older adults often ask is, isn't it normal for blood pressure to increase as I get older? The short answer is yes. Blood pressure tends to rise naturally with age. But why does this happen, and what does it mean for your health? As we age, our arteries and blood vessels undergo several natural changes. One of the key factors is artery stiffness. Over time, the walls of our blood vessels lose some of their flexibility and become stiffer. This stiffening can make it harder for blood to flow smoothly, which in turn raises blood pressure. It's a process that is part of the natural aging process, but it's important to understand its implications. In addition to artery stiffness, hormonal changes that occur with aging also affect the way our heart and arteries function. For example, the levels of certain hormones that help regulate blood pressure may fluctuate, and this can contribute to higher blood pressure readings. But that's not the whole picture. Kidney function also plays a significant role in blood pressure regulation. As we get older, kidney function can naturally decline. Our kidneys are essential for controlling the amount of fluid in our body and maintaining the balance of sodium and potassium, all of which affect blood pressure. When kidney function starts to decline, it becomes more difficult for the body to regulate blood pressure effectively, which is another reason why many older adults may experience higher readings. However, despite these natural changes, many doctors are cautious about aggressively lowering blood pressure in older adults. Why? Because hypotension, or low blood pressure, can be just as dangerous as high blood pressure, particularly in seniors. When blood pressure drops too low, it can lead to a variety of health concerns. Symptoms like dizziness, fainting, confusion, and falls become more common. These episodes can seriously increase the risk of injuries and even be life-threatening. Furthermore, low blood pressure can put additional strain on the kidneys, potentially leading to kidney problems. This is why it's so important to strike a careful balance between managing high blood pressure and avoiding the dangers of lowering it too much. For older adults, the goal is to maintain a healthy blood pressure that supports cardiovascular health without causing the dangerous side effects associated with hypotension. If you are still watching this video and find these lessons useful, please comment 1 below to let me know that you are still here with me. It's crucial to take a holistic approach to managing blood pressure as you age. This means considering not just your blood pressure numbers, but also your overall health, lifestyle, and any underlying conditions that may be contributing to blood pressure changes. In the next section, we'll look at some real-world studies that can provide further insight into how to manage blood pressure safely and effectively as you grow older. Chrt study, key findings. In 2015, the Chrt systolic blood pressure intervention trial made waves in the medical community, as it marked a significant turning point in the approach to blood pressure management. The study involved over 9,300 individuals aged 50 or older, all of whom were at high risk for cardiovascular disease. However, none of the participants had a history of diabetes, dementia, or stroke. The average age of the participants was around 68, placing them in an age group that's especially relevant for this discussion on aging and blood pressure. The participants were divided into two groups to test different approaches to blood pressure treatment. One group received what's known as standard therapy, which aimed to keep their systolic blood pressure at or below 140 millimeters of mercury. The other group received intensive therapy, which aimed for a much stricter target, keeping systolic pressure below 120 millimeters of mercury. This was an ambitious target, especially for older adults, and the study monitored their health for 3 years, tracking things like side effects, chronic diseases, heart-related issues, and even mortality rates. So, what did the study reveal? The results were eye-opening. The group receiving standard therapy experienced a 2.19% annual incidence of major cardiovascular events, which included heart attacks, strokes, and other severe heart-related issues. However, the group that received intensive therapy, with a target of under 120 millimeters of mercury, experienced a slightly lower incidence of 1.65%. This indicates that aiming for a lower blood pressure target might indeed reduce the occurrence of heart-related problems. On the surface, this seems like a victory for stricter blood pressure management. However, the study also showed that the group targeting the lower blood pressure range experienced a higher rate of adverse side effects. These included hypotension, low blood pressure, acute kidney injury, and electrolyte imbalances. While these results were less frequent than cardiovascular problems, they are significant because they highlight the risks of aggressively lowering blood pressure, especially for older adults who are already more vulnerable to falls, kidney issues, and other complications. Hypotension, or dangerously low blood pressure, is a particular concern for seniors, as it can lead to dizziness, fainting, and an increased risk of falls, all of which can cause serious injury. Additionally, older adults are more susceptible to kidney problems, so the risk of acute kidney injury or electrolyte imbalances is something that needs to be carefully managed when considering more aggressive blood pressure treatment. The Chrt study's findings highlight the importance of a balanced approach when managing blood pressure in older adults. While a lower target may reduce the risk of cardiovascular problems, it comes with a trade-off in terms of side effects, especially for those with age-related vulnerabilities. So, what does this mean for you as you get older? It's essential to recognize that a one-size-fits-all approach to blood pressure management doesn't always work. Some individuals may benefit from a more intensive approach to treatment, while others may find that a slightly higher target works better for their health and quality of life. The key takeaway here is that blood pressure management in older adults requires careful consideration of both the benefits and potential risks, and it's crucial to tailor treatment to your unique health needs. Chrt study. Another perspective. Let's shift gears and examine another important study, the Chrt study from 2021. This study analyzed the health outcomes of nearly 20,000 adults in China, all aged between 60 and 80. The purpose of this study was to explore the impact of different blood pressure targets on cardiovascular health in older adults, and it compared two different approaches to treatment. The first group received intensive treatment, aiming for a systolic blood pressure target of less than 130 millimeters of mercury, while the second group followed standard treatment, with a higher target of 150 millimeters of mercury. The results of this study were striking. The group with the stricter blood pressure target, less than 130 millimeters of mercury systolic, experienced a significant reduction in the risk of major cardiovascular events, particularly strokes, compared to the more conservative target of 150 millimeters of mercury. This reinforces the idea that more aggressive blood pressure management may offer cardiovascular protection, especially when it comes to preventing strokes, a leading concern in older adults. However, just like the Chrt study, the Chrt study revealed a critical caveat. While the intensive treatment group had lower rates of cardiovascular events, they also faced a higher risk of some serious side effects. The incidence of hypotension, low blood pressure, was notably higher in this group, which can lead to symptoms like dizziness, fainting, and falls. Additionally, the intensive treatment group was at a higher risk for kidney complications, which is an especially important consideration for older adults whose kidney function may already be declining due to age. Both the Chrt and Chrt studies suggest that while more aggressive blood pressure control can provide valuable cardiovascular benefits, such as a reduction in strokes and overall mortality, it also comes with trade-offs. These studies emphasize that the pursuit of lower blood pressure targets needs to be carefully managed, as the risks of hypotension and kidney problems can outweigh the potential benefits, particularly in older adults who are more vulnerable to these issues. So, what does this mean for you? The key takeaway here is that intensive blood pressure control might not always be the best choice for every older adult. While the benefits in terms of cardiovascular health are clear, the increased risk of side effects like hypotension and kidney damage should be taken into account. For many seniors, A more moderate approach to blood pressure management, such as aiming for a systolic target closer to 140 millimeters of mercury or 150 millimeters of mercury, might be safer and just as effective in maintaining overall health. As we move forward in discussing blood pressure management, it's clear that individualized care is the key. By understanding both the potential benefits and risks of more aggressive treatment, you can work with your healthcare provider to find the blood pressure target that's right for you. Finding the right numbers for personalized care. So, if you're over 65, what's the right blood pressure target for you? The short answer is that there is no universal one-size-fits-all solution. The best approach to managing blood pressure for older adults is individualized treatment. In practice, this means working closely with your healthcare provider to determine a target that balances the benefits of controlling your blood pressure with the potential risks of overtreatment. The Chrt study suggested that a systolic blood pressure target of around 120 millimeters of mercury could help reduce the risk of heart disease and strokes. While this approach may offer significant cardiovascular benefits, it's important to remember that not everyone can tolerate the medications required to achieve such a strict target. Blood pressure medications come with their own set of potential side effects, and what works for one person may not be suitable for another. When blood pressure drops too low, it can cause a range of troubling symptoms. Dizziness, exhaustion, and falls are all common signs of hypotension, low blood pressure, which can be particularly dangerous for older adults. In severe cases, it can lead to kidney problems, confusion, and an increased risk of injury. These are all risks that must be carefully considered when determining how aggressively to treat high blood pressure in older adults. For some seniors, especially those who are frail, have multiple chronic conditions, or take several medications, aiming for a lower target of less than 130 millimeters of mercury might not be the best option. Instead, a slightly higher target, such as aiming for a systolic blood pressure below 140 or 150 millimeters of mercury, might be a safer and more realistic approach. This slightly higher target can still help manage the risk of cardiovascular problems while minimizing the risk of side effects like dizziness, fainting, and kidney issues. The key here is to understand your unique health profile and work with your doctor to find a personalized approach to blood pressure management. Factors like your overall health, the medications you're already taking, and any other chronic conditions you may have should all play a role in determining the best blood pressure target for you. By working closely with your healthcare team and considering your circumstances, you can find the balance that keeps your heart healthy without compromising your quality of life. After all, the goal isn't just to hit a specific number on a chart, it's to maintain your overall well-being and longevity in a way that works for you. Polypharmacy. As we age, it's not uncommon to find ourselves managing multiple health conditions. Whether it's diabetes, high cholesterol, arthritis, or other chronic conditions, many older adults take several medications to manage their health. This practice, known as polypharmacy, is widespread among seniors, and while medications are crucial for managing chronic conditions, it's important to be aware of the risks involved, especially when it comes to blood pressure medications. If you're already taking medications for various health issues, adding stronger or additional blood pressure medications to your routine can increase the risk of drug interactions and side effects. Even medications that are intended to help control blood pressure can have unintended consequences when combined with other treatments. This can make managing your overall health more complex than just aiming for a certain blood pressure target. Common side effects of blood pressure medications include symptoms like dizziness, nausea, and digestive difficulties. While these side effects might seem mild at first, they can have a significant impact on your daily life. Dizziness and fatigue, for example, can interfere with your ability to function and increase the risk of falls, something that's particularly concerning for older adults. Another class of blood pressure medications, ACE inhibitors, angiotensin-converting enzyme inhibitors, often prescribed to treat high blood pressure, can come with their own set of side effects. These include fatigue, weakness, coughing, and swelling of the ankles or feet. Perhaps more concerning, ACE inhibitors can also have an impact on kidney function, which is already a risk area for older adults, given the natural decline in kidney function that occurs with age. With all of these factors in mind, it's clear that managing blood pressure isn't just about reaching a specific number on the chart. It's about understanding how your body responds to the medications you're taking and whether you can tolerate the medication load without compromising your quality of life. Blood pressure control should be part of a broader strategy for maintaining health, one that accounts for your entire health profile, medications, lifestyle, and overall well-being. Before starting or changing any medication regimen, it's important to have an open conversation with your healthcare provider about your concerns. Discussing the risks of polypharmacy and working together to develop a treatment plan that minimizes side effects while still achieving your health goals is key. A personalized approach ensures that you're not just aiming for better numbers, but also protecting your overall quality of life. Lifestyle modifications and non-pharmacological approaches. If you are still watching this video and find these lessons useful, please comment below to let me know that you are still here with me. While medications play a crucial role in managing blood pressure, it's essential to remember that lifestyle changes are just as important, if not more so. Often, simple adjustments to your daily habits can have a significant impact on your overall blood pressure levels, and many of these changes can reduce your reliance on medications. One of the key components of managing blood pressure through lifestyle changes is diet. Eating a well-balanced diet rich in fruits, vegetables, whole grains, and lean protein is essential for keeping your blood pressure in check. A nutritious diet supports overall heart health and can help regulate blood pressure by providing the necessary vitamins and minerals your body needs to function optimally. A well-known eating plan that supports healthy blood pressure is the DASH diet, Dietary Approaches to Stop Hypertension. This diet emphasizes reducing sodium intake and focusing on nutrient-dense foods. Research has shown that the DASH diet is beneficial for people of all ages, but it's particularly effective for older adults looking to manage blood pressure. By cutting back on salt, especially from processed foods and canned soups, and adding less salt during cooking or at the table, you can significantly lower your blood pressure. Reducing sodium intake is one of the most effective ways to help the body maintain healthy blood pressure levels. In addition to diet, regular exercise plays a pivotal role in blood pressure management. You don't need to engage in intense workouts to see benefits. Moderate activities like walking, swimming, or light aerobic exercises can be very effective at lowering blood pressure. The key is consistency. Even a few short sessions of physical activity each week can help lower your blood pressure over time and keep your heart healthy. Maintaining a healthy weight is also crucial in blood pressure management. Losing excess weight, even if it's just a small amount, can have a positive effect on lowering blood pressure. Every pound lost can help ease the burden on your heart and make a significant difference in your overall health. For seniors, this can be particularly important, as maintaining an optimal weight can also reduce the risk of other age-related health problems, such as diabetes and joint issues. Another factor that can influence blood pressure is alcohol consumption. Drinking alcohol in moderation is essential for managing blood pressure. Excessive drinking can raise your blood pressure, so it's important to follow the recommended guidelines. For women, no more than 1 standard drink per day, and for men, no more than 2 standard drinks per day. These guidelines can help prevent alcohol from negatively impacting your blood pressure while still allowing for occasional enjoyment. Stress is another key factor to consider in blood pressure management. Chronic stress can have a significant effect on your blood pressure, leading to higher levels over time. Managing stress through methods like meditation, deep breathing, and yoga can help relax both the body and mind. These techniques not only help reduce the physical effects of stress but can also improve your emotional well-being, creating a more holistic approach to health. In many cases, reducing stress can decrease the amount of medication needed or help lower the dosage required to keep blood pressure under control. Ultimately, integrating these lifestyle changes into your daily routine can significantly enhance your ability to manage your blood pressure. While medication is often necessary, these non-pharmacological approaches can work in tandem with treatment to reduce the need for medication, improve heart health, and help you feel better overall. By adopting a balanced diet, staying active, managing stress, and making mindful choices about alcohol, you can take control of your blood pressure and live a healthier, more fulfilling life. Correct blood pressure measurement. One of the most crucial aspects of managing your blood pressure is making sure that your readings are accurate. While clinical guidelines and studies often emphasize standardized measurements taken in a medical setting, there is growing recognition that home evaluations can provide a more realistic picture of your blood pressure throughout the day. Monitoring your blood pressure at home allows you to track changes in real time and gives you valuable insights into how your body is responding to lifestyle changes, medications, and daily activities. To ensure you're getting accurate readings at home, it's important to follow some key guidelines. First, try to take your measurements at the same time each day. Many experts recommend measuring your blood pressure before breakfast or before taking any medication, as this helps provide consistency. By sticking to a routine, you can more easily spot trends and changes in your readings. Before taking a measurement, make sure you're sitting quietly for at least 5 minutes. Sit in a chair with your feet flat on the floor and your back supported to ensure that your posture doesn't affect your reading. Resting for a few minutes before taking your measurement allows your body to relax and gives you a more accurate result. Using a properly calibrated home monitor is essential for obtaining reliable readings. Make sure the device is appropriate for your arm size, and check that it's working correctly according to the manufacturer's instructions. It's a good idea to have your home monitor checked periodically to ensure it's still providing accurate measurements. When you take your blood pressure, it's best to take 2 or 3 measurements 1 minute apart. This helps account for any natural fluctuations in your reading and provides a more consistent average. Once you've taken the measurements, average the results to get a clearer picture of your blood pressure. In some cases, older adults may experience white coat hypertension, a condition where blood pressure readings are elevated only in a doctor's office due to anxiety or fear. Conversely, masked hypertension occurs when blood pressure appears normal in a medical setting but is elevated at home. This can be concerning because it may go unnoticed until more severe health issues arise. Using a home blood pressure monitor can help identify these conditions, providing you and your doctor with a more complete and accurate picture of your blood pressure throughout the day. By regularly monitoring your blood pressure at home, you can play an active role in managing your health and ensure that any necessary changes to your treatment plan can be made promptly. Home blood pressure monitoring helps you make informed decisions about your health and can complement regular checkups with your healthcare provider. When blood pressure is too high or too low. Managing blood pressure involves more than just monitoring it regularly. It's crucial to know when your blood pressure is too high or too low, as both extremes can be dangerous to your health. Understanding the signs of an emergency and when to seek medical attention can help prevent serious complications. If your blood pressure is consistently in the danger zone, it's time to take action. A systolic pressure, the top number, consistently above 170 millimeters of mercury, or a diastolic pressure, the bottom number, above 100 millimeters of mercury, is a red flag. In this range, you're at higher risk for serious cardiovascular events like heart attacks, strokes, and kidney damage. Most people in this category will need medication to help lower their blood pressure and reduce these risks. Ignoring such high readings can put you at significant risk for life-threatening health problems. If you experience such high readings along with symptoms like severe headaches, chest discomfort, difficulty breathing, or confusion, it's important to seek immediate medical attention. These are signs that you might be experiencing a hypertensive crisis, a medical emergency where your blood pressure has reached dangerously high levels and is threatening your organs. In this case, don't wait. Call your doctor or go to the emergency room right away. On the other hand, low blood pressure, hypotension, can also be just as dangerous, particularly if it's severe. If you start feeling dizzy or frequently tired, it could be a sign that your blood pressure is too low. Blood pressure readings around 90/60th millimeter of mercury or lower are considered low, and this can lead to symptoms like lightheadedness, fainting, and falls. For older adults, low blood pressure can be especially risky because it increases the likelihood of falling, which can result in serious injuries. Sometimes, even well-intentioned treatment for high blood pressure can lead to hypotension. This happens when blood pressure is reduced too aggressively, which may cause your blood pressure to drop to dangerously low levels. This is particularly concerning for older adults, who are already more vulnerable to falls and related complications. It's crucial to work with your doctor to find the right balance, adjusting medications and treatment plans to keep your blood pressure in a safe range that minimizes risks but doesn't lead to excessive drops. In summary, it's important to pay close attention to both ends of the blood pressure spectrum. Extremely high blood pressure requires immediate action to avoid a crisis, while low blood pressure should also be addressed to prevent dizziness and falls. By working closely with your healthcare provider, you can find the right treatment plan that helps maintain blood pressure at a healthy level without going too low. Working with your doctor. The reality is that each of us has a unique set of circumstances when it comes to our health. Different medical histories, varying conditions, and diverse life experiences. That's why it's vital to collaborate with a doctor who knows you well, understands your full medical background, and is familiar with the medications you take as well as any potential side effects you may encounter. This intimate knowledge of your health allows your doctor to make decisions based on your personal needs, rather than simply following generic guidelines. After all, your doctor's judgment about what's best for you is far more important than any broad standard. If you are still watching this video and find these lessons useful, please comment 3 below to let me know that you are still here with me. Take time to talk to your doctor about your health goals, especially if your priority is feeling energetic and mobile rather than just hitting certain blood pressure numbers. If you're willing to accept moderate side effects like dizziness or fatigue to lower the risk of a stroke, it might be worth discussing adjusting your medication regimen. For some, tweaking the dosage or switching to a different medication can minimize those side effects and help you maintain a quality of life. It's also essential to incorporate lifestyle changes such as regular exercise, balanced nutrition, or even stress reduction techniques to help naturally lower your blood pressure. When you take a personalized approach to your health, you aren't just another statistic in a research study. You become an active participant in creating the plan that works best for you. This approach ensures that your health journey is both manageable and meaningful. Key takeaways. In 2017, the guidelines for high blood pressure were updated, setting the new threshold for hypertension at 130/80 mmHg for all adults, including those over the age of 65. Studies like Chrt and Chrt emphasize the benefits of rigorous blood pressure management, but they also bring to light some important concerns, particularly for older adults. While lower blood pressure has its benefits, especially when it comes to reducing the risk of cardiovascular events, it's not without its potential risks, especially when medications are involved. Some older adults might find it safer to aim for a blood pressure target lower than 140 or even 150, as age-related changes naturally affect how the body responds to medication. Rather than aiming for the strict target of below 120, it may be more prudent to aim for a more moderate number. While it's true that medications may come with side effects, the cardiovascular benefits of keeping blood pressure under control should still be considered. In addition to medication, lifestyle changes play a significant role in controlling blood pressure. A well-rounded plan that includes a healthy diet, regular physical activity, weight management, reduced salt intake, moderate alcohol consumption, and stress management can help you stay on top of your health. You can also take charge of your health by regularly monitoring your blood pressure at home, which can reveal hidden issues before they become major problems. Rather than following a one-size-fits-all approach, work with your doctor to design a plan that's both balanced and individualized to meet your specific needs. It's important to recognize that maintaining a blood pressure under 120 millimeters of mercury may not always be worth the physical, emotional, or mental toll, especially if you're dealing with significant side effects. However, do not ignore dangerously high readings like systolic levels above 170 or diastolic levels above 100, as these values can lead to serious health problems. The key takeaway here is that balance is essential, and that your doctor can help you find the best target for your situation. Don't hesitate to discuss any negative side effects with your doctor and ask whether a slightly higher target might be a better fit for your individual needs. At the end of the day, Making these decisions with a comprehensive understanding of your health is far more beneficial than following rigid guidelines. The goal is to be proactive, informed, and involved in your healthcare plan, ensuring it fits your unique needs and circumstances. So, what have you learned so far? We've explored how important it is to work closely with your doctor to tailor your health plan to your unique needs, how small lifestyle changes can make a big impact, and the balance between managing blood pressure and avoiding unnecessary side effects. Now, I want to hear from you. What's one thing you've learned from this video that you plan to bring into your own life? Drop your thoughts in the comments below. I'd love to know how you're planning to make these adjustments. If you enjoyed this video, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more valuable tips on living your healthiest, happiest life. Thanks for watching, and I'll see you in the next video.